stage when we're thinking about who this session is relevant to, but also at the type of cancer. And this is particularly relevant to people who have hormone sensitive or hormone receptor positive breast cancer. About 75 or even a little bit more % of early stage breast cancers are hormone receptor positive. And these are the people in whom we typically recommend hormonal, or also called endocrine, types of therapies. So this session really is relevant to the people who have early stage breast cancer that's hormone receptor positive.
Great, thank you very much. And tell us, we about endocrine therapy, but maybe let's start by defining what is it? What is endocrine therapy, and to whom it applies? We covered a bit of it, and why is it prescribed in early stage breast cancer?
So endocrine therapy is sort of a catch-all phrase that refers to treatments that target the hormones, the female hormones, and those are estrogen and progesterone. And the way that we figure out if a breast cancer is hormone receptor positive is that we look at the tissue sample that we get either from a biopsy or from surgery. And there are things on there called the estrogen receptors and the progesterone receptors that we can test for. And if we see expression of those, it's typically measured as a percentage. So anything 1% or higher is considered to be hormone receptor positive, although the higher it is, the more hormone sensitive it is. So that's kind of the who and how we figure it out. There are different ways the medicines work, and I think you'll maybe ask me to describe the mechanisms in just a moment, but in general, a hormonal therapy or an endocrine therapy is one that basically blocks the effect of these hormones and thereby hopefully reduces the risk of cancer